is with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether, and many of the other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to News Talk 760 WJR.
Oh, Facebook.
Facebook
So we're on
Live.
Facebook Live now, back again on the air at 7:09. So we've got about 2 minutes.
Well, today is going to be a struggle to not get canceled.
Okay.
We're back there. Emery's like, oh no.
Can I get a teaser of what's going on?
Well,
here?
you know, it just
It's always got to come back to the government, but who cares? You can't do anything about the government.
No, but understanding what's wrong with the process of how the government's dealing with the vaccines and how the FDA is handling this, people need to know so they can make the decision, because doctors do not have the tools in their hands to decide how to advise their patients. So all they're being told is get a vaccine when data is being suppressed. And there's actually, in the Pfizer study, again, this came out, believe it or not, in July. We didn't know about it.
But who cares?
I don't know how you say who cares.
Who cares? Because you know what? Well, you can't do anything about the government. But in the meantime, people are getting sick. They need to have a doctor. They need to have somebody save their life, keep them out of the hospital.
But they're still asking these questions. Do I get a vaccine? Do I not get a vaccine?
Well, you just tell them, just say, ask your doctor.
But their doctor doesn't know, because your
then
doctor
tell them all to call you.
Well, then that's a story, but and you can go there, but I still think people want to hear why these are questions. You know, we're here to let them know. And we're here to let them know what they don't know. And so if there's information to be shared about how the government is screwing up our healthcare system, that's why we're doing the show.
But the government has a PhD in screwing up the healthcare system. That's all they've ever done.
Well, that's what the whole show's about, what the government does, you know, what you don't know, what do you have to do. So
welcome back, all of you listeners, to our live weekly medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we're back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, as usual, welcome back. We're still dealing with COVID, and we're still dealing with an entire country that knows nothing about prevention. So what do you have to say to the listeners?
Well, the most important thing, this was shared to me by a listener/patient, that there's a significant correlation between the degree of your vitamin D level and risk from having a COVID complication. So,
really?
Yeah, the higher your vitamin D level, the lower your risk. And this is, you know, again, information not being shared by our mainstream media sources. So,
well, how about your doctor sharing it with you?
The problem, again, we're going to go there now, which is the government and the FDA, which is our government hired agency, is suppressing information about this virus, so people do not have the information. So unless you are free to explore what's available, what's out there, which most doctors are not. Most doctors, again, we talk about 95% of the doctors are hired employees or take insurance, which means they live within the system of FDA approved, means insurance coverage, means this is all I can offer. If you live in that system, you do not have the ability to take the blinders off and see what's available, such as prevention.
Are you talking about doctors not being able to take the blind? Yeah, they
can. No, but they cannot, because
they might not be able to practice it because they are owned by a hospital or a system that doesn't allow them to do it. And maybe, with the insurance the way it is, that they have to check a box, but it doesn't stop the doctor from consulting with the patient and saying, listen, there's stuff out there, like you talk about COVID and monoclonal antibody treatment. People have got to find out about it. They listen to the show, they find out about it. The
But the
doctors,
doctors need to have time to say that to their patients, and most
no,
of them probably
they
don't.
just need to make the time. How about that?
but no, they can't, because they're under quotas, literally quotas that they have to produce X number of visits a day, X number of visits a week. They have to generate X number of testing a day and a week. And they literally have their 5 to 7 minutes face to face with patients to create these quotas established by the bureaucratic hospital systems. And they have to document their note. And these quotas may involve, now again, I don't know, but they may involve documenting, vaccine advocacy. So these doctors, when that's your day, and then you go home and document your day because you don't have time, you don't have time to, oh, what don't I know that isn't going to pay me? This is how I get paid. You don't have time to go and figure out things that don't make you money, or serve your employer. So that's why our system is so messed up. And this is why people, forget the the prevention stuff is very important, but now we're learning that the people, there's nonprofits requesting all of the documentation from the Pfizer study. It's some 300,000 pages of information. And the government, the FDA is petitioning the government to delay the full disclosure for 50 years.
50 years? Why 50 years?
The FDA is saying they can only review for public dissemination 500 pages a day. So at 300,000 pages, that's 20,000 days, 50 years. So talk about transparency. And these are things that should be made public in real time.
But it's not going to happen. So who cares?
But
Move
it's
on. You have to rely on your primary care physician. You have to rely on your doctor.
You're not an investigative journalist. You're a medical journalist, not an investigative journalist. Who cares is not the right answer. It's you want the information to make the decision, and if these documents are buried,
but it's not available to the people that are listening to this show. It's not available to the American public.
Doctor. So what we're telling the listeners is, your doctor doesn't have the information to guide you. And if the FDA wants these studies and this information buried, now granted, this same information was used to get this vaccine approved. They had 100 days and got it approved with the same information, but they're asking for 50 years to get it to the American public. That means they're hiding things.
Yeah.
They don't want you to know what really happened in that study. Because if it was good, it'd be out there to show you, look how good our vaccine is that we've mandated you get. And you're going to lose your job if you don't get this vaccine that's so good. But instead, take this vaccine and you're going to lose your job. By the way, we'll show you this study when, in 50 years. We're going to know who killed Kennedy before this vaccine information comes out. So that's what we're here to let people know, that if you get this vaccine, you're getting a vaccine that the FDA is hiding from you, the information.
Lovely. We'll have to come back and talk about that on the other side of the break. Again, you are listening to our weekly live medical radio show here, where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We are here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Was that so bad?
Yeah, it was bad.
Well, we do have a comment from the WJR live stream on Facebook. Kelly says, Dr. K is right. I used to trust my own doctor until COVID happened. It's a money machine and no longer about our health.
It was always a money machine. Tell her, answer back. It was always, this is
Yeah, but I
America.
mean, it brought to light, a lot of the issues with the healthcare system that maybe some people hadn't faced before. So it's a shame, but
The point of the fact is, it doesn't matter whether they're letting you know or not letting you know. The average person, when they get sick, wants to know, how am I going to
Well,
escape
let's get
death?
there. Let's get there now. I mean, we can go there next segment. Again, that's also not being advertised. So we'll talk about that next segment, about why aren't treatments that are effective being advertised, made available, widely
Right.
available. So
I mean, it's no longer about whether you should get the vaccine or not get the vaccine. And I personally think you should ask your doctor. And if it's me and I'm looking at Matthew Sims' information, right or wrong, I'm just saying the number of people that are going on ventilators and dying are non-vaccinated people. I think they have less of a chance. So who cares about in 50 years whether we find out the vaccine was wrong for us? It doesn't matter. We didn't die last week. And people have to go to the path of least resistance. And all I think that all people care about is, like, if I get sick, where am I going to go? What am I going to do? And the answer, this was my week to do my story, and it's going to get bumped again.
no, you can tell, but I also wanna ask what's going on in Canada? And I only ask because we have a girl on the bus right now who's, she does, like, massage therapy, but she was called on by the government to do immunizations in Canada. She's from, Winnipeg, and she said there you can't travel, you can't do anything unless you have the vaccine. And I'm
Good for
curious if they're
them.
more transparent. Well, but I'm curious if they're more transparent there about, what's going on really so people feel more comfortable overall, because it is a requirement, but maybe they're getting better
Listen,
information.
Canada comes under the crown, okay? So they're going to have to do what the crown says. Like it, lump it. You're getting vaccinated or you're not going anywhere. End of story. And more people will get vaccinated. And Dr. Kolender himself, specialist over here, he got vaccinated. We all got vaccinated. He always said it's better to get vaccinated than not vaccinated.
I'm
So
not getting a booster now, though.
well, who cares about the booster? You've already
Because
had COVID.
Well, but that's not being taken into account either. That COVID immunity is better than being
When
vaccinated
am I back on?
any second.
19, yeah, less than a minute.
Unmarked boxes. Protect your privacy. No way to prevent or exposure.
If you are just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show here on News Talk 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, although we will always want to talk about prevention because that's what your specialty is, we're still dealing with COVID. And we've just been talking about what is the average person to do because they need to rely on their primary care physician to cure them. That's all they've got.
Unfortunately, they don't even have that.
Well, yeah, but it's
because their primary care physician doesn't have the information to give them what they need to know, the choices that they have. And so, again, I'm going back into the rabbit hole, which is there was some information released. And again, this is in July. Why I don't know it till now, I can't really tell you, but there are investigative journalists digging into the data. They're somehow getting it, that the all-cause mortality in the Pfizer study was higher in the treatment group than in the placebo group. That, again, it's being buried in the in the paperwork. So
Well, can you dissect that and translate for the layperson, what that actually means?
well, the most important statistic in a study is all-cause mortality. So that means deaths from any cause, from the treatment group versus the group that received a saline shot. And so you might break up cause of death based on cardiovascular, infection, respiratory failure, but all-cause mortality takes into account all the variables that you may not have a study group for, that the study may not be designed to identify every possible cause of death. So it's actually a more important outcome result than all the different types of death or adverse events that might occur from in a research study. So for instance, I'm a fan of using hormones as a longevity tool, reducing insulin resistance. I'm not going to go into all the details because it's not proven by the FDA to do any of these things, so I can't actually say what it's for. But I'm a fan of balancing hormones. There are many studies that are equivocal on how hormones work or don't work, but pretty much across the board, they all have positive all-cause mortality. That means mostly in men, getting their hormones balanced, they have lower all-cause mortality than in the study group that isn't being treated with hormones. So for that reason alone, I think it's a beneficial tool. So if you look at the outcome of a product, a vaccine, and there's more deaths of any reason in the treatment group, I have to go, maybe this isn't a great thing to do. So back to AnnMarie's, what do people do? Now there's treatments. Again, before this was all going on, I was all for vaccines. But now that there's questions in my mind that there's things being hidden, we have to question these concepts. And so now, especially now that you have monoclonal antibody therapy, great success using, in my practice, hydroxychloroquine, supplements,
Yeah, okay, it's time for me to
But all,
interrupt
all
you.
ahead.
of this,
Okay, well, never
I
mind.
slowed
Siobhan's
down
No, I was
for
going
you.
to say all of this is dependent on having access to a doctor who can give that
Yes.
to you, and that when you show up to the hospital, they're going to be willing to give you this treatment and have the availability to give it to you right away.
Well, the hospital, like we said last week, does not have the availability to
Right.
take care of the community with monoclonal treatment. And, we're in a studio that's got CNN on the background and talking about boosters being available. The FDA is going to approve a pill. Everyone should get a booster. There's no list of, if you get COVID, do X, Y, Z. That's not being promoted to anybody by anywhere. And we say it every show, which is how every news show should be starting, which is, if you get COVID, first of all, if you get sick, get tested immediately. Call your doctor, get on these supplements, your vitamin D3, your zinc, quercetin, vitamin C. And, again, in my mind, I've had 100% success with hydroxychloroquine. Some other doctors use other medicines, which we're not going to name because they get you canceled ASAP, and they do really well. And so and then you get monoclonal if you're still not doing that well. You do that, you're not going in the hospital, period. You're not going to the emergency room.
Okay. As I was about to say before, none of your patients, I say this every time we do a show, of the several hundred people that you are in your practice that have gotten COVID from age 20 to 70, none of them died. None of them went into the hospital. So I have to look at, well, what's your magic elixir? Your magic elixir is that you're treating the disease as all doctors are supposed to do, because COVID-19 is a disease. It's a dangerous disease. And we had a situation, a couple of weeks ago where a friend of ours, 50-year-old guy, his wife had already passed away, and he gets, sick one day, tested the next day. His daughter took him to Beaumont Troy. A week later, he was dead. No pre-existing conditions. But had he gone to someone like you, had he gone to his primary care physician who had the availability to treat him, he might have been alive. He might have survived the COVID, especially if he didn't have any pre-existing conditions. So again, I'm saying again, the patients have the right, the population has the right to have a doctor who's going to treat the disease and help them to get through the disease. And that's what doctors do. and not go to the hospital, not go to just sit around and get nothing happening to you and go on a ventilator and then eventually maybe die from it. It's really serious. And it's up to the doctor. That's what you're doing with your patients. Let every doctor follow you. Let them all call you and figure out what you're doing because you figured out how to make it work. None of your patients have died.
Well, again, you're describing a tragedy that's happened, but I'm
There's
also
a lot of
there's a
tragedies.
lot of tragedy, but I'm also going to suggest that um, because that person got so sick so quickly. Again, I have my non-vaccinated patients that we don't end up in the hospital either. So to me, the vaccine status is no longer, in my mind, a determinant of how your outcome is. Your outcome's the same. You get better. So this person had pre-existing conditions they did not know about.
Oh, well, that
They
might be
just
true.
so the key that happens in my practice is we identify your pre-existing conditions before they're apparent to anybody else, and we take action to lower them.
See, that's a good point. I mean, you're probably correct there. I mean, I think that a lot of people don't, if there's no preventative medicine happening with your primary care physician, there's no screening, there's not the proper screening. Therefore, you don't know what you have or don't have. So, unless you get into a practice like yours where you specialize in prevention, you're doing the screening and the testing that is going to uncover whatever hidden, pre-existing condition you may have that you may not be aware of.
And again, tragic thing to happen to this person, but if you're going to choose not to get vaccinated, which is, in my mind now, a choice you should have, you should be taking extra precautions so that if you get exposed to COVID, you are protected. So if you're going to make the choice to not get vaccinated, you need to make sure that you're living your healthiest life, you're eating the right foods, you exercise, you get a lot of sleep, and you're taking a ton of vitamin D3. You're taking zinc every day, 50 milligrams, and you're taking some reasonable precaution.
Problem is that no one has that kind of shepherding or that kind of knowledge unless they have access to a doctor like you. In the meantime, we're going to have to take a quick break. And again, you are listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
I mean, in my mind, AnnMarie, we said this in April, COVID's over.
It's not even close to being over.
Well, I still think it's over.
I wanted to bring up Matthew Sims because, when he's on TV, that's all he's saying to people is, yeah, of all the people that die that wind up on ventilators and don't make it, the figures were in the paper the other day. It's like 70, 80%. The non-vaccinated ones are the ones that die.
And I'm still going to say that, again, that's horrible, but we're in America. You have a choice, and I know but we're not in England. We don't have a queen. We're not on the crown. We have a choice, and people, there's reason to be suspicious of the choice of what we're being forced to do, but also it's up to the individual to take care of themselves. And if you're going to choose to not be vaccinated, you better make sure you're taking care of yourself.
I know, but people don't know how. And you know what? I'm not buying this because guess what? Wait a minute. Let me finish. To get into school, both of my daughters had to have this vaccination and that one. The all of the necessary vaccinations. You had to present the paper to get into school. Polio vaccine, same thing. Nobody said, "Hi, do you want to get the polio vaccination?" No, it was mandated. So now you're being mandated to get the vaccine in order to, if you have pre-existing conditions or what you don't know about your own body, or if you have pre-existing conditions, your best shot probably was getting the vaccine.
I mean, they have value in certain diseases. Obviously, we've eradicated diseases from the face of the earth using vaccination, so they're not all bad. But again, a lot of other vaccines have had a lot more research behind them and time, to review before they get put out to the public. So when this was an emergency use situation, great, go get vaccines. I only changed my mind after the government started doing, and the government is making medical decisions, making some, I'm going to say very suspicious and non-medical decisions. I'll say bad medical decisions. And so we do have, as doctors, a do no harm.
Right.
Well, that means I'm not going to give you a drug that I don't feel is helpful. There's a lot of drugs that a lot of doctors use, like water, that I don't use because I don't think they're good. And this is one of them. Now it is. And again, I'm not making this recommendation across the board. If you want to go get vaccinated, go get vaccinated. You want to get a booster, go get a booster. If you're high, but you're asking me, well, then there's choices. You can get treatment early and have immunity if you get COVID and not end up in the hospital. That's not being promoted. There's no to-do list on the TV. That's a shame.
We did get some comments on the Facebook feed, but I'll wait till the next Facebook Live to talk about them.
Segment 4.
Mm-hmm.
Wow.
We're having fun.
Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday, 7 p.m. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. Well, Dr. Kolender, it always seems to be a topic of, we never seem to get beyond what do we do about COVID-19 and who's going to treat it when we get sick. And I still come back to saying it's incumbent on the primary care physician, the doctor, to make the decision. For the patient should be able to call their doctor and say, we get calls all the time. People call you and ask you, should I get the vaccine? I have this, I have that.
Well, thanks. People call the office. My staff loves it.
Right. I mean, if you don't have a doctor that you can, that the listeners can get an answer from, then just call 866 Kolender. Dr. Kolender's office will be glad to steer you in the right direction.
Right.
But I mean, what's the answer? I mean, it's not, you can't do anything about the government.
We will soon. Siobhan's got some questions.
No, I just saw, so on our Facebook stream that we do over the break, off the air, someone had commented, was agreeing with you about having to seek early treatment and stay out of the hospital, but she made a comment that remdesivir is basically a death sentence. And I was wondering if you have a comment on that or if you have anything to say about that.
Well, yeah, agree. So even though there was that study that showed that remdesivir reduced hospitalizations, a time in the hospital, we come back to this all-cause mortality problem, or just the mortality rate. And unfortunately, remdesivir did not reduce mortality in their study. So even though hospitalization for people that survived was lower, it did not reduce mortality. So larger studies in Europe brought this to light, and in the United States, no matter, remdesivir is being used in every hospital every time that you get COVID, and it does not affect your ability to survive. So it's horrible that this is happening. So again, why all the effort isn't being put on early prevention, getting a monoclonal antibody therapy. Yep. We don't know. Go ahead.
Okay, so maybe we'll jump to some callers because we had some calls come in. We have Elizabeth on the line. Elizabeth, what's your question?
Yes, I'm a research psychologist who also does, I've done a lot of research, and there's pieces missing from the prevention that the doctor mentioned. For example, he was right about the zinc, but the zinc, in order to penetrate the virus cells, needs to have green tea extract 3 times a day for 7 days. Green tea extract taken at the same time as the zinc. Because what the green tea does is it opens the pathways so that the zinc can get into the cell and kill it. What the zinc kills actually is an enzyme that all viruses need to replicate themselves, to duplicate. If a virus cell cannot copy itself.
Elizabeth,
Then it's
listen,
gonna
we
die.
have a lot of callers. What is your question for the doctor? We've got a lot of people waiting to ask a question. What is your question?
I want to ask the doctor if he would please tell people to take the green tea extract when they take the zinc, and also don't forget the magnesium. Magnesium has been lowered to 12% in multivitamins, so you got to get a separate magnesium.
All right,
All right, well,
we're good.
well, thank you.
Do we have doctor? Did you want to make a comment or?
We'll come back. We have another caller.
Yeah, we got another caller.
Okay, we'll come back to that. So up next we have Dave in Windsor. Dave, what's your question?
My question is in regards to COVID and the vaccines. When a person receives a COVID vaccination for the first dose, and then after 2 or 3 weeks later they get the second dose, and then after that they get a booster shot, what are the chances of the body, depending on their mechanism, rejecting that last shot because they've been receiving it before?
I don't know that we have a concern about rejection, that you're going to develop an allergic response, might be what you're asking about, to the vaccine because you're, developing an antibody to the vaccine itself. But the vaccine's programmed to generate the spike protein to trigger an antibody response to the spike protein. And unfortunately, what we've learned is that the spike protein is inflammatory unto itself. So this is, the concern we have. There's a theoretical concern. This is just very theoretical that continuing to use the same vaccine, I don't know that I want to go down this path. Let me just stick to the idea that we have some suggestions that the vaccine's not as effective to the Delta variant as we want it to be. Why not make a vaccine that is more specific to Delta? And we may get to that. Go ahead,
Siobhan,
Siobhan.
you have another call?
Yeah, we have another call that came in. We have Paulette now in Washington Township. Paulette, what's your question?
Hi, Dr. Kolender. I've always wanted to listen to your show, so today's the first time. I do appreciate your views on COVID. I think they lied to us so much that we can't believe what they say, but that is actually not my question. My question is on heart stuff, which are you a cardiologist?
No, I'm a prevention specialist.
Okay, well, my mom in February was 94. She had a massive stroke. Because of her age, they did not give her any shots. They said she's too old. Can you hear me?
Yep, go ahead.
Go ahead.
Okay. And so she lived for 6 days alive with no food or water. She hung on. What's really amazing is that she would try to get out of her bed. So like part of her brain was still working. Like, I just have so many questions about this. And
Well, give us one
really-
question so because we do have callers. We have to engage. We have some more things to go over.
So do you think a 94-year-old should have had the shot to help her with the stroke?
A booster, like a vaccine?
No. A shot when you have a stroke.
Oh, you mean a thrombolytic to break down the clot? Well,
Yeah.
age is a contraindication to getting the thrombolytic. So and time is. So it's the person needs to be in the emergency room quickly, within 3 to 6 hours. And then unfortunately it really is up to the determination of the doctor on the scene, in the ER, whether that person fits the criteria. So I don't know enough about your mom's health to answer the question, but it might have been a time issue, and then there is an age consideration for delivering the thrombolytics.
It's interesting. Siobhan, do you have any other callers?
No, not at the moment. Yeah, that's it.
Okay, well, we don't have much time left actually, but Dr. Kolender, do you have anything to add before we go to break about where
know,
we're at right
Yeah,
now?
well, coming back to the first caller in this stream of calls, in general, most of us are magnesium deficient. So it's not bad to take some magnesium supplements because during stress, your body uses magnesium more quickly. So it's not a bad idea to just take magnesium for everybody on a regular basis. I've not been recommending the green tea extract. I've had good success, which I've not mentioned, ginger juice, which my wife gave me when I was sick with COVID. I mean, literally drank the ginger juice, and while I was drinking it, I felt my symptoms get better, like as it was going down. And when I finished drinking and I handed her the cup, I said, "It's over. I'm done." And so I haven't heard anyone else have that experience that I did with ginger juice. But as far as the green tea extract, I've had success without it. Does it mean that things would have been better? People would have even recovered quicker? I don't know.
Okay, let's come back and talk some more with Dr. Kolender on the other side of the break. You're listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing and would like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
Okay, so we're back on Facebook Live. Before we get into more conversation, I do have another comment or question, I guess, that came in from a listener on the WJR stream. Lisa says, "This is great that you were speaking out on this subject, and we have been doing prevention all along. I live far from my hometown and have not been able to find a doctor that will order hydroxychloroquine. Are we able to do telehealth with you for an RX for this to have on hand?"
Yeah, I'm going to volunteer my associates to do that. So the answer
Yeah.
is yes.
Mm-hmm.
So
Okay, so
Yeah, they can call Kolender Medical and then one of the other doctors will take care of it.
okay, I will tell her that through the Facebook feed.
And back to this other patient who had a preventive question, but thrombolytics for her mom having a stroke, that's not a preventive service. That's a treatment,
Right,
not prevention.
Mhm.
Prevention's not having a stroke. When you're given a thrombolytic, that's a, very serious treatment for a problem where you're risking death from the treatment. So that's not a light decision to make. And unfortunately, again, it falls into the do no harm. The person had the stroke. It's not the ER doctor's fault, that they did or didn't, and they don't want to kill the person,
Yeah,
with a
that's true.
drug.
Yeah.
So it's not a simple decision to administer a thrombolytic. The best thing to do is not be in that position where someone's got to decide that they're going to give you a treatment that has a 5% chance of killing you.
Mm-hmm. Yeah, and the
So,
hospitals are always going to be worried about getting sued, right?
well, it's just a tough call all around, sued or not sued. You don't want to kill somebody if you
That's
can,
true.
I mean, you didn't cause a stroke. They came in with a stroke and you're going to do your best, but you don't want to kill them.
Right.
So it's, that's not prevention. That's treatment.
I don't know what the answer is in order to get people on board with the idea of prevention. I mean, we talk about it all the time, but I just don't think that enough people are gonna, it's not sinking in. They got to start when they're 20, 30 years old, and they have to actually engineer getting the test themselves.
Well, why do you think that's the case?
Just wrong country to be in. Gotta leave. I
Well,
mean,
I think it's
no, but I
think
mean,
a lack of
it's
information.
ridiculous.
It's a lack of information, and it takes investment, and it takes work. And I think there are probably people that maybe they don't discover prevention until they're in their 40s, 50s, and they think, oh, well, I was supposed to have started when I was in my 20s, so now it's too late. So there's probably a bit of that too.
It's never too late. As long as you're alive and functioning, it's not too late. I mean, I'm seeing a 90-year-old soon, who started in the practice at 90.
Wow.
So he did his first part, and we're going to see him, and he's going to be virtual. So I saw him when he came in for his labs, and we're going to do a virtual visit, 90 years old. So if you're alive and want to work, and stay alive, well, then age doesn't matter. It's, your choices.
We had a call coming.
You have another
in.
caller?
All right, good. I'm going to take the rest of this segment off. You guys talk.
Oh, you're just going to walk off the screen and
I
just
need a-
leave us?
Two callers.
I need a break.
Two
No, we have
callers.
I'm
two
getting
callers.
hoarse.
And I think there's more coming. So
Oh, Maya, they're
ready.
waiting to the
Three.
very last. Three. We have three. Four. We have four.
4. Oh, he's still typing.
Wait.
Tell
5.
them they got 5 seconds. Ask
Right.
a question.
Yeah.
Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat the chronic and debilitating diseases. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. And Dr. Kolender, you've got at least 5 people lined up waiting to ask a question. Let me tell the listeners that if you're calling in, please make it brief because we want to have to listen to all the questions before we have to shut down the show. So who's your call, Siobhan?
Okay, let's start with Rebecca and Redford first. Rebecca, what's your question?
Hi, I'm 73, and I was just wondering if there are any special tests seniors need other than a good physical at this age, and what is the doctor saying now about the COVID shot? Is he for it or against it? Because last week it sounded a little bit different, and I'll hang up. Thank you.
Well, thanks for calling. So the most important test is to do a carotid ultrasound, which is a carotid intima media thickness test that looks at the artery wall. So we just were talking about this during the break, which is age is not the factor. It's you want to be the best you, and you don't want to have a disease. So there's no comparing you to anybody else in your age group because you're different from everybody. So for you, and again, I am recommending booster shots for seniors because seniors are at the highest risk. So now that's not for every senior, but those are the ones that I know, and I know their health really well. I might tell them it's optional. But not knowing you, the answer is you're at a higher risk. You're over 70, get a vaccine, get the booster.
Okay, up next we have Lewis in Tecumseh. Lewis, what's your question?
Good evening. My mother got the Moderna shot, and then a couple of months later, she had a stroke. She's extremely healthy, active, ballroom dancing. There's no underlying conditions whatsoever. Is there any correlation between the RMA vaccine and stroke?
Well, again, she needs a full evaluation to identify, what her underlying disease is and what her drivers of chronic illness are to answer that question. Again, we were talking about this earlier that the vaccine and the virus both have a spike protein, which generates an inflammatory response in your body. And inflammation is what drives chronic disease. So I can't, maybe I'm answering your question a little cryptically, but I don't know anything about her underlying condition to be able to tell you that. So, most people have plaque and they have, they've got drivers of inflammation they don't know about. So that's what we do in our practice is identify all those conditions and reduce them so you don't have an adverse event like a stroke, vaccine, virus, or whatever.
Okay, Doc.
Okay, up
Siobhan?
next we have Jesse in Richmond. Jesse, what's your question?
Hello, thank you for taking my call. I have a almost 7-year-old daughter. She's kind of like her mother, very sensitive to medications. She has had allergic reactions to antibiotics, and we're debating whether to give her the COVID vaccine or not. And, we're concerned about some of the heart conditions popping up because of it, and just wanting to know your recommendations.
All right. Well, keep in mind, I'm not a pediatrician and I'm not your child's daughter. Doctor, thank you. So, my general feeling is that children rarely, and I say rarely in capitals, have adverse events from COVID. So, there's rare deaths and rare severe complications of COVID. And in the study where they studied the children from 5 to 11, there's a highly publicized case where one of the children in the study group who received the vaccine had a severe adverse event. And just the course of her and her parents trying to take care of her, she was excluded from the study. So literally the day after getting her second dose, she became severely ill. And now her and her family are suing the FDA for what happened to her to be included in the study. So technically, based on if you include her in that study, there's a very high risk of the vaccine causing an adverse event. But she was excluded, so now the vaccine is being marketed as safe and effective, even though no one in the study was exposed to COVID to determine if it helped them compared to the placebo group. So that's my answer.
Okay, Siobhan, next, how many callers do we have?
Okay, up next we have Rod and Wyandotte. Rod, what's your question?
Hi. Hey, there was a researcher here on this, on the same station, and she was making the point that a lot of people are not getting the vaccination because they're like really, like they have like a religious conviction, and they're like under the conviction that these vaccines are originally produced from aborted fetal tissue.
My gosh, this is so ridiculous.
Is
They're
that
still
true?
talking about this. Okay.
Is that true?
Again, I'm going to go with I do not have any information to support that statement. I'm not saying it is true by saying that. I'm saying I don't see how it's true, and I don't have anything supporting that. So
Do we have any other?
I think there's reasons enough to be conscientious objectors, but again, if you're going to choose that route, you had better make sure you're healthy, and you'd better make sure that you're doing everything you can to deal with COVID if you get it, and don't do nothing about it.
We have another caller. Let's move on.
Yep. Okay. All right. So let's go to Pam and Warren. Pam, what's your question?
I was wondering if you're aware of ivermectin and its counterpart, which is artemisinin, which is wormwood.
I am familiar with ivermectin. I'm not familiar with wormwood. So I wouldn't label myself as like a holistic naturopath. My main practice is preventing heart attacks and strokes and dementia and chronic illness and whatever I need in my practice to do those things. But I'm not I don't utilize entirely naturopathic methods to achieve my goals. So I'm not, but I am familiar with ivermectin.
Okay. Your number is 866, and I couldn't get your last name. I didn't hear that at the beginning of the program.
It's 866 Kolender, KOLENDER. If you have further questions, 866 Kolender, KOLENDER.
Well, that was the best question of the night. Thank you very much.
Right.
And
Exactly.
we're going to move on because we're near the end of the show. Anything you want to wrap up, AnnMarie?
No, we've had a lot of callers though, and certainly it's always coming back to COVID and how to treat it. But again, as I would say, I go back to people need to ally themselves with a doctor like yourself who's going to shepherd them through it, answer the questions, tell them whether they should get a vaccine or not. I think it's incumbent on your doctor to help you make these decisions and not to pay attention to whatever the government's doing. Rely on your doctor.
That would be nice.
Exactly, especially with you, right?
Right.
Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks to my co-host, Siobhan Cronin, out there on her tour in Philadelphia. Please continue to tune into our shows Sunday afternoon at 3 and Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.